And so, Dr. Baker, we've discussed kind of offline the many different initiatives that HEAL has. And, I think it'd be really helpful for our audience and for some of the panelists as well to understand a little bit more about which ideas and technologies that HEAL is currently prioritizing and what gaps you feel there may be and where you see things heading.
Thank you, Danielle, and thank you again for the opportunity to speak with all of you today. I'll start with just a tiny introduction to the HEAL initiative, or Helping to End Addiction Long Term. This is part of the NIH's response to the national crisis of opioid misuse, addiction, and overdose, contributed in large part by a need for effective pain management. So what we have done in the past couple of years is initiate a very large and broad research effort, about $2 billion, 600 different research projects, lots of different areas of focus, ranging all the way from new medications and therapeutics for treating pain and opioid use disorder, all the way to understanding management of co-occurring health conditions, how to put interventions into primary care settings and emergency care settings, and translating research into practice in places where people with pain and addiction come seeking help. So it spans a lot of the different areas that I know will be part of this meeting. What we're really seeking to accomplish through the initiative is to give our broader community, and just as Dr. Kerns mentioned, that includes patients and stakeholders, clinicians, caregivers, information about what works best for pain and additional options for treating it outside of opioid medications. And so we've been able to draw on resources in lots of different parts of our broader research ecosystem to start thinking about those things. So we have a number of awards that we made to small businesses that have kind of a technology component, and some academic groups as well, focusing on interventions a lot of times for opioid use disorder, for helping someone stay on treatment, medication-based treatment, or kind of cognitive behavioral therapy-based apps, or telephone or virtual therapy for both pain and opioid use disorder. But then we're also working to build kind of a data ecosystem that will allow the innovations coming out of these studies to connect with one another and be a substrate for future discovery and also dissemination efforts. So in terms of the, what's the highest priority, it's got to be things that are going to matter to patients and things that will advance the field when it comes to understanding pain, because we have a lot to do there. And I'm focusing on pain, but there's also a lot to do in the area of understanding substance use disorders more generally, and how a person, has more than one health condition at one time. So I would say those are the biggest current needs as we look at them, and we have a lot of different opportunities out there for funding. It's kind of a very iterative and ongoing effort in the HEAL initiative to provide those opportunities to the research community.
I'm curious, so how does that work? So how does the HEAL initiative set the priorities? Are those as much in response to innovative ideas as to the needs of patients and communities, or is there some interaction between those?
Oh, for sure there is an interaction, and an evolution as well. So as we begin to learn more, or as we begin to fund, certain categories, then we can expand into other categories. So I would say when we started in 2019, we were really focused on kind of new medications for pain and opioid use disorder, what's in the pipeline that we could accelerate, and then for both non-pharmacological pain management strategies and evidence-based interventions for opioid use disorder, we have a lot of effective tools out there. So putting them into the hands of first responders, like we had some very kind of top of the head easy things to do right away. And then with time, we started to say, well, a lot of people with substance use disorder, either in treatment or in recovery, also experience pain. So what types of research programs would we need to address those, and how would psychotherapy fit in, and how would medications for the treatment of opioid use disorder, some of which also work for managing pain, fit in? And so then we can kind of keep iterating over time in terms of filling those needs. For almost all of the different types of programs, even ones focusing specifically on back pain, and a precision medicine approach to treating back pain, we're still collecting technological based approaches, but they're kind of applied across the research portfolio.
Very cool. Yeah, I would imagine that, especially the emergence of or the rise of telepsychiatry and telehealth during the pandemic, that a lot of the tools, especially digital tools that have been discussed in this summit earlier, become increasingly more relevant. Well, thank you so much for presenting an overview of the HEAL initiative and what you're interested in, and a lot of the progress that we've made so far.